Hi, everybody. Amy Conley here with United Way of Door County. If you are watching us live, happy Friday of Labor Day weekend. And if you're watching this later on, just know we did record this on Friday morning. So I know we're both pretty excited about the 3-day weekend. So with me today, I have Cami. Cami, do you want to introduce yourself to everyone?
Sure. My name is Cami Pagar, and I am the Community Impact Coordinator of Health here at United Way. So I work with our Stride School-Based Mental Health Coalition, our Door County Alcohol and Other Drug Coalition, and then our Healthy Door County Coalition. So
Wonderful.
yeah,
Anything health, right?
anything health, yes.
So today, though, we're specifically going to talk about the Alcohol and Other Drug Coalition. And for those of you watching, Cami started with us in this position of February of 2020. So you'll remember that was a month before COVID hit. And then everything went to safer at home. So our programming in the last year and a half has looked a little different than it did pre-COVID. So Cami's going to do her best to explain the different things that the AODA coalition does. However, I can chime in as her boss and add some of those things if needed. So if people are watching and be like, why doesn't she know her job? Don't worry, she knows her job. She just doesn't know what we did before COVID. So Cami, what's a little bit about the Alcohol and Drug Coalition?
So our mission is to prevent and reduce substance misuse in Door County. Our coalition consists of many community partners, including, public health, health and human services, the Door County Sheriff's Department, the Sturgeon Bay Police Department, mental health providers, schools, just a general good collection. We meet and discuss what do we need to do in Door County? What is Door County's issues? What are the resources that we're lacking here, and how can we address them? I personally work a lot with all the Door County schools to target that youth population. As we know, you targeting these habits and issues while we're younger is a little bit easier to do than when they're already ingrained in your brain. So we do a lot of work with the schools, and we do a lot of educational either trainings or getting information out there that may be applicable to alcohol and other drug issues. And we do provide different actual physical resources that may help you to, safely
safely use your medications.
Yes.
Or I know at one point we had cabinet locks. So for people who have alcohol in their homes, which is legal for any of us over 21 to do. But we know we sometimes have children, or all the time have children in our house. So I know we provided cabinet locks at one point, right?
Yes, they're great, especially if you have that garage fridge with your beverages in it. And kids are tricky and sneaky, so you want to keep that stuff locked up.
And then medication lock boxes, that's another thing you provide, right? Why would someone want a medication lockbox?
Right. So right now we're in an opioid crisis. We have a lot of opioids. We have a lot of prescription medications, and our state is doing state opioid responses. So we had written grants. We had gotten one last year and gotten one this year to provide materials to help just reduce misusing those medications. So we've gotten lock boxes to safely store your medications in your home. We had gotten medication deactivation kits. It's a really cool little pouch that you put either pills or liquid or patches in. Fill it with water, you seal it up, it deactivates that medication, and you can toss it away. And then we had previously and we will in the future work with the Sheriff's Department and the ADRC to do drug take back events with the Meals on Wheels.
Wonderful. And for folks who don't know, if you don't have access to those deactivation kits or aren't getting Meals on Wheels, if you're able to get to Sturgeon Bay to the sheriff's office, you can just go to the sheriff's office and drop off your medication at any point in time, no questions asked, and they'll dispose of it properly for you. Is there a drop in Sister Bay as well, Cami? I felt they had a box,
Yes,
but
there
I might be wrong.
there is somewhere, and there's also one on Washington Island. I do have a
Okay.
list of all those if you need them.
Yeah.
My email is Cami, CAMI @unitedwaydc.com.
And what's a phone number for you, Cami?
920-421-2177.
Okay. And then for the kids, so obviously the kids side has looked very different for you since you have started. But many of our viewers might remember several years ago, we started something called Project 180 in the schools. Cami, can you talk about that a little bit?
Yeah, so our Project 180 is the peer-led mentor group in the Door County schools. The school counselors or other teachers volunteer to be leads for that, and they meet and pick projects each year that revolve around either an AOD, an alcohol and other drug, or a mental health topic, and carry those out each year in schools. They do have quarterly meetings where they all get together 4 times a school year to discuss, current trends. What are you doing? We work with Mike McGowan on that to just really get these projects going in the school and really be as good of a peer leader as they can.
So each school has
Mhm.
their own group and they work on their own projects, but then also they come together, like the leadership team kind of would come
Yes,
together so that the kids from each of the schools are coming together to share ideas and resources as well, right?
correct. Yes.
Okay, wonderful. And Mike McGowan has been part of our alcohol and drug work for many years. And last year, yeah, I can't keep track of my years with COVID.
They're blending.
Last year, Mike did some videos for us, and those videos really did a good job of helping kids understand what might be going on at home, some of the behaviors of their parents or peers during COVID, and providing them with coping resources, or if they needed to make phone calls to appropriate resources as well to do that. And people can find those videos. We still have those on our YouTube page. So if you're a YouTube user, you can just go to YouTube and you can type in United Way of Door County. And I know those are, I think, under a separate playlist under there. But if you just search for Mike McGowan, then on our page, you'll find those. And Cami, do we know what the kids are going to be doing this year, or is it too early with just having a few days of school?
It's too early yet. Only half
Okay.
the schools started in the county, so we'll give them a little time to get acclimated to school this year before we can get into those projects.
Good. And one of the things we did pre-COVID is we would have community gatherings where we would show different documentaries, have panel discussions around drugs and alcohol. And I know we haven't done anything on Zoom in that area in the last year and a half, but I think we're hoping to have some Zoom showing opportunities coming up yet this year, possibly.
Yes, we had actually discussed it with the Door County Mental Wellness Group to have a fall showing of the Cracked Up movie.
Okay.
And we will get some things planned. So we will have them. As of right now, the dates are not set, but yes, we do
That's
have
okay.
those.
Wonderful. Yeah, so people can follow on Facebook, either the United Way Facebook page, or Cami, what's the Facebook page for the Alcohol and Drug Coalition?
The Door County AOD Coalition.
Okay, so Door County AOD Coalition on Facebook, and that's a good way to keep up with things there. Cami also shares on that page some interesting information just on drug and alcohol trends, some data-driven reports as well. So if people are wanting to learn more about that, they can find those resources there. Well, Cami, as you know, we end all of these interviews by talking about ALICE. And for our viewers, ALICE stands for Asset Limited, Income Constrained Employed. So this is, we've had a few of these where I'm like, this is kind of a tricky question when I say, how does your program specifically impact those that are ALICE? And I think the thing to remember, first of all, is drug and alcohol addictions, drug and alcohol problems, they impact everyone, no matter their income. So that is definitely something that people need to remember, that you could be the wealthiest person and maybe struggle with drugs and alcohol, or you might be someone that's Alice that struggles with drugs and alcohol as well. But Cami, do you have any thoughts on how your program works with those who might be in the Alice budget?
Well, really just to try to promote those healthy lifestyles, especially when it comes to the drugs and alcohol in general, helps with some of those costs. And then providing those resources that they may not even know are out there or have access to get, just so that we can get those in their hands to make sure that they are getting what they need.
Good. Yeah, so everything that Cami talked about is free. So, if you are somebody wanting information on those deactivation pouches or a medication lockbox or some of our programming coming up, feel free to reach out to her. I think right now we're out of medication lockboxes though, right? There's along with everything else, there's a national shortage.
We're having a hard time. We got to approve the grant this year, but we are having a hard time get them because everything is out of stock. So I do have some fun travel lock bags. If you're traveling, they're great to put medications in to keep them safe. Some deactivation kits, and I might have like a couple of small lock boxes left.
Okay,
So
wonderful. Well, good. So again, Cami, how can people reach you?
sure. My email is Cami, CAMI @unitedwaydc.com. And my phone number is 920-421-2177.
Wonderful. Well, Cami, thanks for everything you do and the members of your coalition, and we'll talk to you soon. All right.
Sounds
Thanks,
great.
everybody.
Thanks.
Bye-bye.